Thank you. Good evening, everyone. Thank you, Mr. Backus. As Mr. Backus has said, I'm a practicing nephrologist in Georgia, and I take care of patients daily, in local hospitals and on an outpatient basis who have longstanding kidney disease and those who develop short-term injury to the kidneys. So during this pandemic, I've had the opportunity to take care of quite a few patients who have developed COVID-19, those who have required ICU care, the sickest of the sick, and those who have not been as sick, but yet have had issues with their kidney. So COVID-19, as we know, is caused by the SARS-CoV-2 coronavirus. It's a virus that causes respiratory illness in humans because it is predominantly airborne. But in addition to lung disease, other organs in the body are affected, including the kidneys. Other organs and systems include the liver, heart, the gastrointestinal, the hematological, which is the bone marrow and blood, and nervous systems. And these, and of course, infections thus cause a high rate of death or mortality, and sometimes causes multi-organ failure in these infected patients. The kidneys are two bean-shaped organs, each about the size of a fist, that are located below the rib cage on either side of the spine. And we know that healthy kidneys filter about a half cup of blood every minute, removing waste and extra water to make urine. What are some of the other jobs that the kidney does? We know definitely removes waste and extra fluids. We know it also helps to control blood pressure. But we know also that kidneys need adequate levels of blood pressure to work properly. And such, in patients who are extremely sick, where their blood pressures are very low, in sepsis, they are prone to kidney injury. Other things that the kidney does, it helps to make red blood cells. It makes a hormone called erythropoietin, which stimulates your bone marrow to make red blood cells and prevents anemia. It also helps to keep the bones healthy and also controls the acid levels in the blood by getting rid of excess acid. As spoken before by Dr. Richardson, some of the comorbidities and conditions that have been associated with severe illness and mortality include cardiovascular disease, which includes high blood pressure, diabetes, COPD, which is chronic obstructive pulmonary disease and other lung diseases, cancers, chronic kidney disease, which I will speak about, obesity, smoking, to name a few. The most common causes we know of chronic kidney disease worldwide are diabetes and high blood pressure. Hypertension is an important risk factor for cardiovascular disease in the Caribbean and globally. It is responsible for approximately 51% of deaths due to stroke and 45% of the deaths due to ischemic heart disease, which are the leading causes of death in the Caribbean. The prevalence of high blood pressure is high, affecting approximately 35 to 38% in St Kitts, BVI, and Grenada, 21% of all adults in Barbados and Trinidad and Tobago, and about 25% of the population in Jamaica, according to stats from the World Health Organization. So we know that high blood pressure has far-reaching consequences, and thus lowering blood pressure helps with lowering the cardiovascular disease, and thus stroke, coronary artery disease, heart attacks, diabetes complications, and chronic kidney disease and early death. In the Caribbean, the overall prevalence of diabetes mellitus, or blood sugar, or sugar as we say, is estimated to be approximately 9% and is responsible for 13.8% of all deaths among adults in the region. Diabetes is therefore one of the major public health challenges for the Caribbean in the 21st century. And this comes from the International Journey of Equity Health, which was published in 2015, these stats. The Federation of St Kitts and Nevis has approximately 13% prevalence of diabetes per International Diabetes Federation, Diabetes Atlas in 2019. Thus, there would be an increased incidence of the risk factors for chronic kidney disease. Chronic kidney disease, or CKD for short, is defined by the presence of kidney damage or decreased kidney function for more for 3 or more months, irrespective of the cause, whether it be high blood pressure, diabetes, or other diseases. This persistence of the damage or decreased function for at least 3 months is necessary to distinguish chronic kidney disease from acute kidney disease or acute kidney injury. Kidney damage refers to the structural abnormalities, whether established by a kidney biopsy or by imaging studies or from markers, which we look at from urinary sediment, such as increased protein excretion into the urine. This decreased kidney function refers to a decreased ability of the kidney to filter these wastes and poisons from the blood, which is usually estimated by something we calculate as the glomerular filtration rate, or GFR. And this is used, what we use to calculate this GFR is the serum creatinine, which is a waste product of muscle, which is only excreted by the kidney. So kidney failure is the end stage of chronic kidney disease and is defined as severely reduced kidney function, requiring treatment with dialysis. The term end-stage kidney disease generally refers to chronic kidney failure treated either with dialysis or transplantation. Acute kidney injury may therefore complicate chronic kidney disease and hasten its progression, producing kidney failure or shutdown. So setting the background and definitions of what is considered chronic kidney disease, let's define what is acute kidney injury. And this is what we see a lot of in COVID-19. Acute kidney injury, therefore, is an abrupt, quick onset, usually reversible decline in the GFR or kidney function. It results in the elevation of serum blood urea nitrogen, so these are the wastes, the creatinine, and other metabolic waste products in the blood that are normally gotten rid of or excreted by the kidney. So an infection with COVID-19 definitely can damage the kidneys and increase the risk of needing kidney dialysis. Lessons learned in the United States and other countries that have been ravaged by the pandemic show that there has been a rise in chronic kidney disease cases. That is permanent damage to the kidney, though not total failure of the kidney because of this infection. Patients with kidney disease also have other illnesses or comorbidities, including high blood pressure, diabetes, heart disease, that are risk factors for poor outcomes with COVID-19 infection. Apart from lung disease, acute kidney injury is one of the most frequent and most severe organ complications in this infection. The virus has been detected in kidney tissue, and this is one of the things that we believe causes such damage to the kidney. So patients with chronic kidney disease before and on dialysis, and specifically transplant patients, kidney transplant patients, they are an especially vulnerable population. The increasing number of COVID-19 infected patients with kidney involvement led to an evolving interest in why there was so much acute kidney injury. So COVID-19 kidney damage. So we know that some people show signs of kidney damage, even those who have had no underlying kidney problems before they were infected with COVID. And that was one of the key things that was seen in China and especially in New York when the pandemic began, that people had moderate to severe kidney injury. Signs of kidney problems in patients with COVID-19 include high levels of protein in the urine and abnormal blood work, abnormal waste products in the blood, abnormal electrolytes, sodium, potassium, increased acid levels in the blood. The kidney damage was in some cases severe enough to require dialysis, and during the pandemic, hospitals which experienced surges of patients who were very ill with COVID-19 reported not only running short on ventilators to support breathing, but also the machines and sterile fluids needed to perform kidney procedures like dialysis. In some cases, treatment had to be rationed as supplies were scarce. Many patients with severe COVID-19 are those with coexisting chronic conditions, as previously said, high blood pressure and diabetes, both of which increase the risk of kidney disease. More alarming was seeing kidney damage in people who did not have kidney problems before they got infected with the virus. So questions arose as to how does COVID-19 damage the kidneys? We feel that COVID targets the kidney cells. The virus itself infects the cells of the kidney. The kidney cells have certain receptors that enable the COVID virus to attach to them, invade the tissues, and make copies of itself, potentially damaging the kidney tissue. Similar receptors are found on the cells of the lung and the heart, where the new coronavirus has been shown to cause injury. Another way is that too little oxygen can cause kidneys to malfunction. And with the pneumonia that the COVID causes and the severe decrease in oxygen in the blood, that in itself causes additional damage to the kidney. As previously spoken by Dr. Richardson, the cytokine storms can also destroy the kidney tissue. The body's reaction to the infection may be responsible as well. The immune response to the new coronavirus can be extreme in some people, leading to this cytokine storm. When that happens, the immune system sends a rush of these cytokines into the body, which are small proteins that help the cells communicate to fight an infection. But the sudden large influx can cause severe inflammation, killing and destroying healthy kidney tissue. The other thing that we've found is that it also causes blood clots that might clog up the kidneys. We know that each kidney has about 1 million nephrons or filtering units. And the kidneys are like filters that screen out these toxins. And when the clots form in the filtering units, it affects the function of the kidney and its ability to filter the blood. So long-term implications of this acute kidney injury. It was discovered that recovered COVID-19 patients who had acute kidney injury or the acute renal failure should be seen regularly by kidney doctors after their infection, or followed by their primary care physician to follow their kidney tests, because their risk of developing permanent kidney damage is higher than others. So when we talk about acute kidney injury, what are some of those things that we look for as physicians, especially when we talk to family members, is we talk about decreased urine output. We talk about fluid retention. These patients tend to hold on to a lot of fluid. They get swelling in the legs, the ankles, the feet. And because of extra fluid retention, they get shortness of breath, which also exacerbates the pneumonia that they have and those issues. Other signs now of chronic kidney disease. So maybe after they have developed, they got the COVID infection, they got some damage to the kidneys. They also had permanent damage, some lasting damage, and developed chronic kidney disease. So some of those signs of chronic kidney disease include more fatigue, less energy, having trouble concentrating, having trouble sleeping, dry, itchy skin, the need to urinate more often, especially at night, sometimes blood in the urine, foamy urine because of excess protein excretion in the urine, because the filters of the kidneys have been damaged, increased puffiness around the eyes, swelling around the eyes, which we call periorbital edema, swollen feet and ankles, poor appetite because of increased waste products building up in the blood, and cramping muscles because of abnormal electrolytes. During this pandemic, I have treated quite a few patients who developed acute kidney injury during their course with COVID-19 infection. Those who recovered from COVID-19, some have had lingering damage to the kidneys, and many of them, their kidney function definitely has not resumed to its previous baseline. Many of the ill patients, once developing kidney failure, have gone on, of course, to pass. And unfortunately, this is a real problem with this pandemic. Of one note, I have one patient. He had some mild kidney damage prior to the pandemic, and I followed him for several years, and his kidney function was stable. He developed COVID-19 infection. He was not the worst. He was not in the worst shape, but he had COVID pneumonia. He developed acute kidney injury, required dialysis, and is now dialysis dependent 1 year post-COVID infection. During this process, because of being sick and taking a long time to recover, it affected his family because he was out of work, and the economic impact to his family was pretty severe. He has now returned to work, but of course is stuck on dialysis. He's currently being evaluated for transplant. So, of course, this is a very serious matter to have COVID infection because it can affect the kidneys long term. And of course, the impact of chronic kidney disease is very high. I would suggest to all that if you have the ability to get the vaccine, that you take it, because COVID-19 infection respects no one. It respects neither socioeconomic status, it respects neither class, it respects no one. And the severity of illness that you can experience is pretty bad. And of course, as we know, many people have died from this. And of course, there are long-lasting effects. And as a kidney doctor, I implore you, kidney disease is nothing to play with. So I would ask that you would take the vaccine if it's offered. Thank you.